What do you see as the most pressing health challenges women face today?
Human rights, because our ability to have bodily autonomy is related to our health. And as we see in the States, they've criminalized women's health care, sexual health care. They're letting young women bleed to death and go septic before they'll provide them with a simple procedure that would save their lives. And I think in Texas, it had astronomical number of deaths since Roe was overturned. They talk about it being pro-life, but they don't care about the women. And part of that is control. Because if you control our health care, our sexual health care, and our birth control, then you control us completely. And so what is the biggest challenge? Access to contraception and sexual health care. And that is completely non-negotiable in the system. Equality, equity, bodily autonomy, and human rights are non-negotiable. And so, watching all these young women die for no reason is ridiculous. Like, women have died from a tubal pregnancy, and that's not even viable. So when they tell me that it's pro-life, but they're willing to allow that woman to have their fallopian tubes burst and go septic and lose the ability to have a child again or lose their life, tells me that, men need to get out of our wombs and get out of our doctor's offices. Because, if you take birth control away, then that removes our ability to really continue our education or participate in the workforce, which is what our mothers and older suffered from, right? So birth control, as simple as it is, it allows women to decide when and how many children they can have or want or afford. And so without having access to mental health or sexual health care, you've actually shoved women into poverty when we're already making less money per hour per man, where you watch the States and there's all this big DEI thing and, but those days are gone. Built in the system, 50% of the jobs are women and 50% of the jobs are minority. So really, everybody has a quarter of the pie because there's enough jobs for everybody if we actually build a system that we're going towards. And so, yeah, to me, the biggest barrier is men blocking our ability to access care.